Hi, this is Carissa Karamanis O'Brien coming to you from EMS World Expo in Las Vegas, and I'm here with Dr. Ben Bobrow. Welcome. Thanks for joining us.
Thank you, Carissa. Thanks for having me.
So tell me a little bit about the Heart Rescue Project and what it really means.
Yeah, so the Heart Rescue Project is a really novel, bold initiative that's supported by the Medtronic Foundation. And what it is they've gotten 5 states together who are really interested in cardiac arrest and have done a lot of work in cardiac arrest, sort of system organization. And sort of the goal is for us to improve survival from cardiac arrest, one of the leading killers in the country, by 50% in each state over the next 5 years. And to do that, we've really collaborated. We've developed some best practices and protocols and kind of guide. Basically what we're doing is we're implementing the latest resuscitation guidelines in our states and accurately measuring that with the goal of improving survival. And then ultimately trying to help other communities figure out how to do the same.
Very good. So what is really your role in the project?
So I'm very honored to be one of the principal investigators for the Arizona State Heart Rescue Project, along with the other states being Washington, North Carolina, Minnesota, and Pennsylvania. And we also have some other partners that are key partners, AMR and Ohio State University. So what I do is I help organize the activities and the data and the measurement and the interventions in Arizona, and it's been just a huge opportunity for us. We're continuously getting better with our measuring cardiac arrest outcome and process, and it's really exciting because we're just continuously getting better and saving more people.
That's some exciting momentum. So tell me, why is the data so important to sort of contributing to the increase in survival rates?
Yeah, well, it's a good question. You know, we all want to improve survival rates from cardiac arrest, but it's really hard, if not impossible, to improve something if you can't measure. And cardiac arrest is one of those things that you actually have to measure lots of different things. You know, there's multiple kind of links in the chain of survival, and they're all important. And if you're not measuring and kind of tweaking and improving, it's really hard to save more lives. So that's why really measurement is sort of the mantra of the Heart Rescue Project, and really kind of at the core of it. And we figured out a lot about how to best measure and monitor cardiac arrest, and so our hope is that we can now help other communities do the same.
It's a smart approach. So how is EMS really involved? Why are they such a critical role in this project?
I would say EMS is really kind of the linchpin in cardiac arrest survival. And the reason is everything really revolves around your EMS system. What I mean, even your 911 system, your dispatch system, the ability for people in your community to get public information about cardiac arrest, and then the really highly important EMS response, the quality of the EMS resuscitation, and then even the data collection, which is really kind of hinges around the EMS providers because they have access to most of this data, and then linking the data with hospital data to get outcomes. So really it kind of all revolves around EMS, although it does involve the public is a big part of Heart Rescue, and then also hospitals are a big part of Heart Rescue also.
So how can the community stay involved, being aware of how, what's going on with the project? Where can they go?
Well, the community is actually a huge part of Heart Rescue. Specifically, I'll be a little more clear about that, is this topic of bystander CPR. Bystander CPR is such an important determinant of survival from cardiac arrest. And so what the public actually understands about cardiac arrest, being able to identify cardiac arrest and being able and willing to do things like bystander CPR and using an AED if that's available, is a huge part of Heart Rescue. The public we really encourage people to go to heartrescueproject.com, and they can get information about what we're doing and how they can participate and how they can even look towards improving cardiac arrest and survival in their communities.
Very good. And we know that the resources available on that site as well.
Yes, and that's one of the things. All the states have helped develop those resources. We've kind of developed best practices that we've all shared, and they're all available on the website for people to use. And that's all we want, is people to take a look and hopefully use those.
Exactly. Well, it's such a worthwhile project. We thank you for your efforts and, of course, for being here and sharing a little bit with us today.
Good. Thanks for your time.
Again, this is Carissa Karamanos O'Brien coming to you from EMS World Expo in Las Vegas, Nevada.